recording.
There we go.
We're now. All right. So I am distracted by the ice storm because I turn into my little kid self with the possibility of snow. Even though I'm an adult and I now work in a profession which doesn't allow me to be off just because it snows anymore. And so this is a damn technology, but moment. But the little kid in me is still very, very excited at the fact that um, something will be shut down somewhere, somehow. At some point, I'm going to figure out how to make this mean that I don't have to do something.
Well, if you don't have power, we're definitely not working.
Oh, yeah, yeah. I don't know if I want to be without heat and like a way to cook my food, but
Hmm.
skip for a couple of hours. I don't have a book, but I'm so excited to be in my bed reading a book.
Yeah.
Tons of books, actually. So I have one. Oh, I do have a book. Okay. All right. So calming down and trying to be my adult professional self. Today we're going to talk about 5 signs. Let me see what my title was. That you should go to sex therapy.
Hmm.
Is that it?
I
Yeah.
think that you need a sex therapist or that you might need a sex
Five.
therapist.
Yeah.
Yeah.
5 signs that you need a sex therapist. So I thought that was really interesting.
Hmm.
And so let's go. All right, Jessica, sign number 1. Oh, how are you?
I'm
Yeah.
good.
Okay. Are you prepared for the storm as much as you can be?
Not at all. But there's a couple of days before it happens, so it'll be
They
fine.
do. They did. I've been watching it all morning long, and you have
Hmm.
until night falls tomorrow night. So
Yeah,
about
it's like
36 more
Saturday night
hours.
is when things are going to get, but according to the temperature, it's not really until Monday that it drops significantly because
Oh,
Sunday is still like in the 40s, 50s, and it
right.
doesn't really get below freezing regularly. So I think it's actually going to be the Sunday to Monday that's going to be real bad.
Okay. All right. Look, I'll find a way to make it work so that I don't have
It'll
to do anything.
It'll be fine. We'll figure it out. Yeah. Well, one of the things I think is really important on this topic is like I was doing a consult for a client recently and they were talking about like, things going on with their sex life or not feeling like they're confident or not feeling like their drive has been what it has been and feeling like that's a little off. So I think something feeling off is a good sign to potentially going to a sex therapist, that is a really good like this doesn't feel right or I don't feel like I used to or something's changed and I'm trying to wrap my head around it or I don't know exactly what this means or I've avoided this for way too long. I probably need to talk to him. But what I thought was really interesting is I was like a lot of people forget the therapist part at the end. Like they're so focused on the sex part that they're like, but my anxiety. And it's like, yeah, that affects your sex life too. So like
Yeah.
we are a therapist who
Okay.
focuses on sex, but that doesn't mean we can't help with all of the things that other therapists help with. It's just
Right.
we're also informed on sex.
Yeah. I was just talking to some supervisees yesterday, and I was reminding them that from my perspective of being in this field like almost 20 years now, is that sex therapy isn't so much about the sex.
Mm-mm.
And I think the biggest gift we give to our clients is just being able to have the conversation,
Hmm.
that we're a safe place for you to have a conversation. So, your number 1, can you give it to me in a succinct 1 sentence for
Something feels off.
something feels off? All right. So, my number 2 would be I'm not understanding something regarding
Okay.
sex and sexuality.
Yep.
I'm not understanding something. Um, I'm not going to my parents. I'm not going to my pastor. I tried to
Yeah.
talk about it with my
I mean,
partner.
even going to a doctor is very unreliable.
Yeah. And so, yeah, I love my doctors. I love everybody in the medical field. They do literally save lives. And they probably could all benefit from a bedside manner class.
Well, and they're not focused on sexual function. Their focus is
Right.
on are you alive or not?
Yes.
Period.
Period. And so, therefore, there are going to be definitely times when you have a medical situation, which I'm going to actually make the number 3, after a medical occurrence
Hmm.
that impacted your sexual functioning, that's a
Mm-hmm.
time when you might need to see a sex therapist.
Mm-hmm.
So, our fabulous doctors and nurses, as Jessica just said, I'm going to repeat her, don't have training in sexuality and the act of sex and
Even
sexuality.
gynecologists.
Even gynecologists, they study the body parts, the body functioning, which is different from sexual functioning.
Mm-hmm.
And so, if you have had prostate cancer, that's number one. You, after you leave the oncologist, you need to make an appointment with a sex therapist so you can have some conversations.
Mm-hmm.
Breast cancer, ovarian cancer, like
Mm-hmm.
those are the big three. You need to be calling us immediately with
Mm-hmm.
that, just to help you think through some things, have some conversations that you didn't know you need to have, ask some questions to your docs that you didn't know you need to ask.
Mm-hmm.
Like that would be so beneficial. That would be number three. All right. So coming back up to number two. So what number three was after something medical,
Mm-hmm.
after something medical, but it could be after something medical, like somebody in my circle's partner. They're not in my circle. So I'm saying this very much more cavalier than if it was somebody close to me. Like just kind of had a heart attack,
Mm-hmm.
and so it's like, oh my god. But that's something that can throw off your sexual functioning and how
Shoulder
you
surgery,
connect.
hip
Oh my
surgery,
god,
knee
shoulder surgery.
surgery, like
Right.
any
Mm-hmm.
type of back issue.
Mm-hmm.
Like my back has gone out before. Absolutely the last thing on my mind is sex because
Right.
like I can't even stand up. So
Mm-hmm.
like any of those things, even mental health issues, like I have some clients that are like, I just got my meds good and it tanked my libido, but I am not willing to mess with my meds because I feel good.
Mm-hmm.
So how do I deal with my sex life then
That's
at this
good.
point?
I think number four has to be after a mid change.
Oh, well, I was also thinking of like, because I don't want it all to be negative necessarily, like
Okay.
something could be better. Like,
Ooh.
yeah, like
Okay.
go see a sex therapist for improvement. Like just because things are
Mm-hmm.
good doesn't mean they can't be better. Like working with a
Mm-hmm. Mm-hmm.
professional to like what piece am I missing or what would be helpful or what would help spice it up or what would help make this regular or
Mm-hmm.
like we can level up as well. So you don't
Ooh.
need to be at a deficit. You
Mm-hmm.
could just be like things are good, but like maybe we could use with like
Okay.
an evaluation or a tune up.
So number five is to level up. Ooh, I like it. Okay. What would be another positive? It'd be so nice that couples who were virgins when they got married came in and had a conversation with us.
Significant religious experiences, yes.
Yes, that would be. We're gonna put
Yeah.
that as number six. We're past number five, but hey, we're on the
Yeah.
roll.
Yeah.
That would be nice.
Oof.
If
Yeah.
you have, this goes back. This go. This is what I've noticed several times throughout the years.
Mm-hmm.
That there have been a couple of people throughout the years, like it,
Mm-hmm.
that have gotten an STD diagnosis, and it
Mm-hmm.
shut them down sexually. It shut them down from dating,
Mm-hmm.
and so those people need to come and see a sex therapist.
I would say that
Any
that would
therapist,
probably fall under a medical
a
thing.
medical thing.
But I
Okay.
think
It is.
along that track, I would also say anybody who has had any type of sexual trauma.
Ooh,
That would be like a
yes,
seven. Is
yes,
any child molestation, rape, anything like that.
yes,
Domestic violence situation where you no
yes.
longer feel safe with your partner, like that needs to be a sex therapist thing as well.
Right. Oh, this is such a good list. All right. So I'm going to put relationship. I put medical trauma. Did I meant to put medical trauma? Yeah. And then relationship issues with DV under it. I don't
Okay.
know why I'm writing a list like I need to give this to somebody.
Well, I think
I
one
need
was
to
something
organize.
feels off. Two was to learn something more or to
Right.
understand something.
Yep.
Three was some type of medical event or medical change.
After I have after something happens.
Okay.
After like a, who knows what I meant. I just put after something.
Okay.
Okay, but go ahead. To level up was number five, which I loved.
What was four?
Four was after a medical change, a med
Okay.
change.
Med change. So
Yeah,
medication changes versus a medical event.
correct.
Okay.
Okay. And then we have
Six
number
was
six.
religious.
Yep, significant thing, religious thing,
And then seven
um,
was trauma, sexual trauma.
trauma. And then 8 was relationship issues, including domestic violence
Okay.
and stuff like that. Um, yeah. And so, more than anything, I want you guys to know what Jessica's already said. I'm just repeating you today. So, I'm just going to repeat you today is that we're trained as therapists first.
Yeah.
Like, we're therapists first. We just went the extra step after the therapy training to get more information about sex and sexuality.
Yeah.
That's it. But we're therapists first,
Mm-hmm.
literally. Like I was a professional counselor first, then I was a marriage and family therapy. So we're like adding on layers, but the
Mm-hmm.
basics are there.
Mm-hmm.
And so, however, in your mind, you feel like nobody else is dealing with this problem, nobody else was going to understand, I guarantee you we're going to understand. Like we've heard different cases, we've learned things, and I'm trying to think, is it a situation where we wouldn't understand? And I think even if we didn't understand, we're going to work to understand.
Mm-hmm.
We're going to in the beginning of my counseling career, I had 2 to 3 cases that were over my head,
Mm-hmm.
just over my head. And so, um and thank you clients who bared with me during those early years of things being over my head. But what I learned is, and actually my clients taught me this, because
Mm-hmm.
one of my clients said, we have nobody else to talk to about this.
See, and this is what I feel like is a number 9. If you're looking
Mm-hmm.
for a non judgmental therapist, if you're
Ooh,
feeling like you can't find anyone else to talk to, like we
yeah,
literally talk about the most private things
yeah,
all the time. So, like,
yeah,
you're not going to come in here and get a bug eyed, oh my
yeah.
God, car in the headlights expression. You're going to be like, okay, and like, how does that affect you? And you're just like, wait,
That's true. Which is
seriously?
actually how sex therapists wind up getting a lot of the poly cases at the
Yeah.
beginning, is because we would just listen non-judgmentally.
Mm-hmm.
And so, and I felt for the poly people because I'd be in trainings
Mm-hmm.
saying, okay, I have this polycule in my office. So and so facilitator, help me apply what you just said to my polycule. And they're
Mm-hmm.
saying, oh no, you can't. Poly doesn't work. Okay, whether it works or not, I got 3 people sitting in my office trying to figure out how to help it make it work.
Yeah.
Help me help them.
Yeah.
And so thank you to all my clients who were patient while I was trying to figure it out and trying to get the
Mm-hmm.
answers and trying to figure out the right modality, the theology, everything to fix it. And I want you to know is that's what we do.
Mm-hmm.
So even if we don't have the answers, we're going to sit there and try to figure it out with you.
Mm-hmm.
I love it. This is one of my therapy mentors. He gave me this example of a fabulous story. And so he was like, there is an old man on the side of the road whose truck had got stuck in the mud.
Mm-hmm.
And the Good Samaritan comes along and he's like, I'll help you try to get the truck out of the mud.
Mm-hmm.
And so he tries and tries. They do every which way. They're like pulling it. They're pulling it. They're like going a little deeper in the mud to try to get more
Mm-hmm.
traction. Like they do everything. At the
Mm-hmm.
end, the old man's so frustrated, he just sits down in the mud. And then
Mm-hmm.
the Good Samaritan sits down with him. And he's like, what are you doing? Why are you sitting, why are you sitting in the mud with me? And he was like, because I can't do anything else right now. So I'm just going to be here with you.
Mm.
And so my mentor said, sometimes that is all we can do in therapy, but that is what we will do. Like that is what we will do. And I have a couple of clients like, I am with you watching your life. You are not making it up. It is mud
It's
right now.
bad.
It it,
Yeah.
it is like you are not over exaggerating because some people feel like, oh my God, I must be over exaggerating. You're not. And so if we do nothing else,
Yeah.
sometimes we just validate like your
Mm-hmm.
so and so died and your so and so died and then your cat died and then like you lost your job and then this happened, this happened. You are not making it up.
No.
This is not. And I'm here to sit with you. And you guys, that is so comforting.
Mm-hmm.
Like I've felt it and I've
Mm-hmm.
seen it. To have
Mm-hmm.
just have somebody say you're not making up, to
Yeah.
have a place where you can cry and you're not judged, to have a
Mm-hmm.
place where you can rage and you're not judged.
Mm-hmm.
So you can say those things that's
Mm-hmm.
running around in your head out loud.
Mm-hmm.
And so, um, yeah, you're looking for a non-judgmental space. All right, so number 10, we have to change the title of the episode. Number 10 is you need to be heard.
Mm.
Yeah. And so I see that differently as being non-judgmental.
Mm-hmm.
Um, and I don't know why I see that as being different. But I think sometimes people just need a safe place to be heard,
Mm-hmm.
to have your own little place. I think that's probably what I use my therapist for, to say all the things that I can't say out loud anywhere else, you
Mm-hmm.
know? And sometimes it's just like shit down. So, but I can't say them anywhere else about anything else, you know?
Mm-hmm.
And so if you need a place just to be heard, just to say some things out loud, then I think any sex therapist would be happy to serve in that area. One of the things that I think that we excel at as sex therapists is to be able to sit with those very hard topics and just sit there, which is absolutely a gift that I think we love to give, to be that safe
Mm-hmm.
place of sitting there.
Mm-hmm.
As you, there are going to be times in life where you just need a place to be quiet, to figure out what you're going to do next, to make changes, who you want to be in the world. Sometimes there's some like fundamental changes that you have to make about who you are. And it's nice to have a quiet place to sit, to talk to somebody else. Like, let me just say this out loud. I'm thinking about blowing up my life and doing this. And I can't tell anybody. And I don't know the best way to do that. And that's really exciting. And so we want to give you guys these gifts
Mm-hmm.
um, of life, because I think these are the priceless moments and times. They're one of the things we can give. All right, Jessica, what else is coming up for you?
I think to a certain extent, at least in the way that I practice, like it makes me think of Mary Poppins bag of
Oh,
like there is always something else in there. There is always some other technique. There is always some other perspective. Because you were talking about like sitting down in the mud, and I'm like, yes, and
okay.
how about neither of us sit in the mud and I take my working vehicle and we go to a mechanic? like, like, how about you hop in and neither of us sit in the mud and we go wait it out in a coffee shop for it to stop raining?
I'm not gonna.
Like, maybe we need to take a break from trying to fix the problem and wait for the circumstances to change, and
Yeah.
then we can fix the problem or get other people who are like a tow truck who has something different than what we have available to us in order to fix the problem, versus like now our pants are muddy and the truck is not going anywhere.
I love that. I love that because I have had clients in situations where it's just like, yeah, we need to sit here a minute.
Yeah.
And because this situation is not changing anytime
Mm-hmm.
quickly, but as soon as it changes, then we can make a run for it. Like we can do something different. We can do
Yeah.
something. And so,
Well, and I've
so I
also worked
love that.
with
I'm going to add on to
clients.
my story. I'm going to add.
Yeah, no, you're good. Well, and like with some of my clients, we are talking about connection, and they were so bogged down in circumstances that we couldn't access connection because of all of the
Mhm.
circumstances. So I'm like, all right, what does it mean to
Yeah,
change the circumstances? So we spent the rest of the session was like, how do we move out of state?
yeah, yeah.
Because that was more pertinent to the connection
Hmm.
than trying to find time in a busy job when the world doesn't
Hmm.
feel safe and the state doesn't feel safe. Okay, what does it mean to relocate? How can we focus on that? And it was amazing that changing that one thing of like, okay, we're not going to focus on connection amidst all of this. We're going to
Yeah,
move you.
yeah.
And they immediately like, they were like, body language was forward. They were more energized. They felt more hopeful because it was, wait, we can just change it. And it's like, yeah,
Hmm.
we could just scrap it all and like not
Hmm.
do this anymore.
Hmm. I think I'm so glad I'm older and wiser. All right. I think I want to give you guys permission to come to therapy, even if you don't want to work on the thing that you know needs to be worked on. And so I will say, as a younger clinician, I would have been like, I don't know how to help you. As an older clinician now, I'd be, oh yeah, definitely come. There's a there's pre-contemplation before contemplation.
Mm-hmm.
And so let's sit in pre-contemplation however long you need. And so I want to give you guys permission that if there's something you're like, yeah, I know I need to work on this, and no, I'm not ready to work on it, come to therapy anyway. And let's pre-contemplate on what that could look or how, or How do we get you ready to get ready?
Mm-hmm.
All of those things. And I love those things. And I'm so glad I'm an older clinician now, because that would have freaked me out as a younger clinician. Because I remember having cases and they're like, yeah, I don't want to work on this problem. Okay, I don't know how to help you. And now I do.
That
Yeah.
is the response that is absolutely coming up in me of like, absolutely not. Do I want like that would frustrate the hell out of me. I would not be able to figure that out. Like
Oh,
I think I have a hard time having a tolerance for, well, I'm just gonna sit here in the mud. And it's like there's a coffee shop right across the street. Like, I don't understand why we're sitting in the mud. And that's probably like, I am autistic. So there is a certain
yeah.
amount of like,
Hmm. Yeah,
that
like,
doesn't make sense. I don't
yeah.
understand. And so it's not a judgment. Like, if you wanted to sit in the mud, like, absolutely, obviously,
Yeah.
textures. Like the autistic part of my brain is like, that's going to be wet and squishy, and you're going to need a shower, and you're going to
Yeah.
need clean clothes. And
Hmm.
that's just causing more problems.
I definitely do see that. I definitely do see that. So, okay. All right. So, if you want quick, fast action, Jessica's the one for you. If you need to just sit there a moment and just be like, what the what?
Yeah.
Like, I don't even understand what happened or how I got here. Then I'll sit there with you. So, okay. All right. Closing down. Last thoughts for today.
Um, if this is speaking to you in any way, reach out. Like, I think
Mm,
if, regardless of why you come or why you're thinking of it, if it makes you pause, if it makes you like, wait, do I?
mm,
Like, follow through with that. Like
mm-hmm,
there's a reason why you're seeing this today. There's a reason why this came up. There's a reason why you stopped and paused. So like, think about that, and what does that look like, and how does that play out, and kind of follow that thought, because I think sometimes it's telling you something, or your body is telling you something to pay attention to.
mm. We got up at the church on Sunday, and for whatever reason, I've been using that guy's message all week long.
Yeah.
I should write him and say, thank you. You empowered my session. But one of the things that he says is our giftings are a gift to be given. Like, a gift isn't a gift until it's
Mm.
given.
Mm-hmm.
And he specifically was talking about our
Mm-hmm.
purpose in life, and that our gift, whatever we have.
Mm-hmm.
Um, and so my gift is to be able to sit with you,
Mm-hmm.
to be able to sit and talk.
Mm-hmm.
And I can't give my gift unless you receive the gift.
Mm.
And so I just want you to know that we are here and we're ready to receive. That's it. So, and I should really write that guy and say, that was really powerful. Like, in church, it was just like, yeah, whatever. And
Yeah.
then I keep
It's
finding
sat.
ways to use it.
Yeah.
Yeah. In the thing. So, if I got paid for my content, I'd have to give them $1, but I don't get paid. So, hey, there we go. All right. You guys have an amazing day, and we'll see you guys next week. Thanks, Jessica.
You're welcome.
All
Bye.
right. Bye bye.